Hello, this is Dr. Eric Bricker, Chief Medical Officer of First Stop Health, and today I want to speak with you about what virtual primary care companies have to offer. And it generally falls into three categories. So, first category is unscheduled sick visits. So, of course, we all get sick in an unplanned fashion, whether it be for a sore throat, or it could be for nausea, vomiting, it could be for a bladder infection, it could even be for a rash. And this way, patients can actually be seen by a virtual primary care physician without an appointment. They can just contact us by phone or by our app or by our website, and literally within minutes, they can be seen by the virtual primary care physician who's essentially sort of like on call. Now, it might not be their chosen physician, but still, both the urgent care doctor that they see at that time and their chosen virtual primary care physician, they all use the same electronic medical record, so they'll be able to share continuous information about each patient. So that brings me to point number 2, which is virtual primary care companies offer scheduled visits for chronic conditions such as diabetes and hypertension, and even for things like depression, because believe it or not, primary care physicians actually see a ton of patients for mental health issues like depression and anxiety, and it's very common for them to prescribe antidepressants and anxiety medications to treat those conditions on a long-term basis. Very common. Myself as a primary care physician, I prescribe those quite frequently. Now, what's nice about the scheduled visits is you're actually able to schedule a visit with a primary care physician of your choosing, and you can have continuity and keep seeing the same physician over and over again so that you can develop a relationship with them. Now, third and final is preventive screening referrals. So those screenings kind of fall into a variety of categories, and they are from the U.S. Preventive Services Task Force. I'm sure you're familiar with that. And so I'll just go through a few of them. So some are lab-based, such as screening glucose for diabetes, and also screening for high cholesterol as well. And so of course you can't virtually draw somebody's blood, but what's nice is that the virtual primary care physician can actually send in an order electronically to a local lab, and you can just show up and they'll already have the order and they can draw your blood, and the results will automatically be sent back to the electronic medical record of the ordering physician, and then they can contact the patient to be like, okay, hey, your blood work looks fine, or no, your cholesterol is actually kind of high, and we probably need to start a statin medication, or what have you. Screenings also fall into the category of imaging for things like mammograms or even CT scans of the lungs for long-time smokers. Again, the order can be sent into the imaging facility. Person can just show up and have their scan done. Finally, there of course are referrals to actual specialists like a gastroenterologist for a screening colonoscopy. Again, the virtual primary care physician, they don't just be like, hey, you need to go find a GI doctor. Like, the virtual primary care practice would actually find GI physicians that are in network at locations that are close by to you, that have appointment availability that's convenient for you, because really the primary care physician should be acting as the quarterback in terms of coordinating all those variety of screening tests. Now, why is it important for an employer to offer virtual primary care services? Well, it really is a strategy to address the high-cost claimants that represent 5% of the population that drive 50% of the costs. And the majority of those claimants fall into 3 diagnostic categories of musculoskeletal, cardiovascular, and cancer. Now, it is really hard to intervene and do anything to improve quality or lower costs once one of those catastrophic issues has occurred, unfortunately. So the best thing for an employer to do is address them in advance through primary care. And virtual primary care is a great way to do it. You can think of virtual primary care as a way for an employer to engage in direct contracting with a primary care practice. So I wanted to present to you today what virtual primary care companies have to offer, and thank you for watching.